much better today.
We did good. We practiced that, you guys. What's up? Joey is on.
All right. Sierra
So,
on a few times. Hey, guys.
Yay. Hey. So we're going to go ahead and talk a little bit about intern year. So I've mentioned before, for those of you who don't know, there are approximately 120 PM&R programs in the country. About 20% of them are what we call categorical programs, and then the rest are advanced programs. And what that means is when you are categorical, your intern year is attached to the last 3 years of your residency. So all 4 years are typically done in one hospital. However, the majority of PM&R residencies, they are advanced, meaning you interview and you match into your intern year the same time you interview and match into PM&R. So you go and do your intern year at another hospital, and then a year later, you pack up and sometimes have to move and you start your PGY2 year in PM&R. So we're going to just talk about that a little bit today with one of my favorite interns, soon to be PGY2 here in the next month, is Dr. Yi Chu. I met Yi when he was a 4th year medical student. He rotated with me and he was amazing. When you rotate with me, like I'm not going to judge anyone. I'm just going to let you see how it goes. And then by the end of it, I was like, listen, he really wants to come to your program. I called the program director and I was like, he's amazing. I didn't even tell him I called, but he was that good. So it is a pleasure to have him on. So Dr. Chu, if you can go ahead and tell us a little bit more about yourself.
Yeah, thanks so much for the introduction, and thanks for having me on the show. Hopefully I can give some good advice today. But yeah, so I'm originally from Houston, grew up there, did my undergraduate at Rice in Houston, did bioengineering there, went on to do med school at TCOM in Fort Worth, and then, yeah, as Dr. Williams mentioned, intern right now, doing that over at Medical City Weatherford.
Great. So Yi, so tell us a little bit about, the application process. How many programs did you interview for PM&R or apply and interview at, and then how many for your intern year?
Yeah, so for PM&R, I applied to around 60 programs.
60?
60, yep.
Mm-hmm.
Probably a little bit more than I needed to. I got nervous and I was like not sure if I was going to get interviewed or anything. So I was like, better just go big and then see what happens after that.
Go big or go home.
Yeah, exactly. And so for PM&R, so 60 programs, I think I ended up getting like maybe 30 or so offers. Ended up going on 12 PM&R interviews, just because that's kind of what my counselor at TCOM had recommended. That's like a kind of magic number. For prelims, so I mostly applied to prelim internal medicine, didn't really apply to any of the surgery ones, and I did apply to a handful of the TY transitional years.
Can you tell them a little? Can you tell them a little bit about the difference in those as well, the different years?
Yes. So basically, those 3 like main categories. The TY year is your transitional year, and I think for me, like that one seems to have like a really diverse set of rotations that you go through, and it's not really necessarily very heavy on one field, but you do get like a really
coveted. Some are very cush. Yeah, they're very coveted.
Yeah, exactly. And so they're very coveted. Many people like them because they're, lighter intern years sometimes, not always, right. But
don't talk about us that did the team. No, I'm just kidding. I went to one of those years, you guys.
And some of them, you work a lot harder. For the prelim, the internal medicine ones, that's probably the most common one that you'll apply to. And they tend to be more heavy on the internal medicine rotation. I've seen some that are, like 8 or 10 months of internal medicine, like a lot. And then some are lower. I've seen some that are like 3 or 4 as well. And then finally you have your prelim surgery, which I don't see too many PM&R residents doing them. I've only met a couple myself. And they liked it, and I think they were just that type of personality that liked the surgery type atmosphere.
Hustle bustle.
Mm-hmm. Yeah, so plus and minus. Personally, I think that the prelim, the internal medicine one, is probably more relevant for PM&R, just because you do a lot of inpatient medicine, and I think that what you'll learn there is definitely more relevant.
Totally agree.
I agree. Yep.
So I'm sorry, I had interrupted you. So how many of those programs did you apply to?
So I applied to 45 basically intern year programs. I unfortunately did not get a lot of offers for interviews like I did for PM&R, but I did end up going on 3 of those interviews.
Very good. And I'll kind of chime in too, and Sheena can. When you are applying for these intern years, it's nice to apply to a big number because you're also competing against those who are doing radiology is advanced, ophthalmology is typically advanced, dermatology is typically advanced, and yeah, it's typically advanced. So it's just a larger pool of people that are applying for these 1-year spots.
Yeah,
I agree. Yeah, I think I applied to 40 or something all around the country, and I ended up matching in Brooklyn. So yeah. I was fortunate to get, a prelim medicine spot. So
yeah. And and if you don't get a spot, there's typically going to be a spot open in the country. I have several friends that have scrambled in the spot. We'll have Dr. Kristen Taylor on in a few weeks. 1 second. Hey, Dad. I'm sorry. Sorry. That was my dad. She'll be on a few, and she scrambled into a very good year in Florida. She loved it. So we can have her talk about it when she's on.
Yeah, and I think the emphasis should be getting the PM&R residency, and not to overlook the intern year as well, but if you don't get it, it's not the end of the world.
Yes, very good. So go ahead.
I was just going to ask about the class size. So how many co-residents or co-interns do you have?
Yeah, so my program, we have 18 total residents, intern residents. 12 of us are prelim, 6 of us are medicine residents. And then of the 12 prelim, 7 of us are PM&R.
Wow, yeah.
No, that's nice. I'm sure to have a nice group of PM&R, especially if you have anyone that's going to be in your class moving forward. You guys kind of get a chance to mesh and work well for the rest of the year.
I think that's definitely rare in terms of numbers, right, Benecia? I don't know how at JPS what your transitional year was, but
I was the only one.
I was at Woodhull in Brooklyn, and it was like I think 15 or so, just internal medicine interns, and then we only had 4 prelim, and one was a radiologist, ophthalmology, neurology, and then myself. So I think that's great that you have 6 other PM&R,
for sure.
Yeah,
there was 12 in my class, and 9 of them were radiology. Then it was myself, and then a dermatologist, and then ophthalmology. So can you tell us a little bit about how your intern year is set up? How many rotations do you have to go on, and any electives?
Yeah. So my program has specifically a PM&R track for prelims. And so the way ours is set up is it's 10 core rotations. Of the 10, 4 of them are internal medicine. 1 is emergency medicine. You do 1 month of general surgery, 1 month radiology, 1 month pain management, 1 month a combination of OMM, sports med, and then 1 month of geriatrics. And so
that is perfect for
awesome.
PM&R.
Yeah, it's very well timed for PM&R residents. Yeah. And then we get 2 electives. And so the electives that I chose to do, I did 1 month in PM&R, and then I have my second one coming up that I'm going to do in orthopedics.
Yeah, and he got to come down to our office for that 1 month, which is fun. Yeah, it's Dr. Joey says that's the PM&R Mecca. Was that Weatherford? You guys have let the secret out the back.
It's going to be the most competitive transitional year now next year. All right. So,
right.
So did you do any preparation after you graduate from medical school going into intern year? Did you study ahead or read up on anything?
So I probably should have. because I was not super prepared going into my intern year. And I know there's like a lot of people out there that, you know, do recommend studying just to prepare yourself. Personally, I don't think that's super necessary. I think at the end of your 4th year, you should kind of try to enjoy what little vacation time you get. So, you know, go travel, pick up a hobby, visit some family that you haven't seen in a while. Because once residency starts, it's going to be really hard to find time to do those things. And so like when I first started my intern year, I started internal medicine nights. And so I was super scared and nervous because I hadn't done medicine for like almost 2 years. And so the nurse, I remember that first night, the nurse calls me and was like, hey, can this patient get some Zofran? And I was like so nervous. I was like, yeah, sure. I was putting in this order for some medicine for this patient. And I was like, do I need to go see this patient? Like, do I need to get an EKG? Like, monitor the QT? I don't know what I'm supposed to do. And so, but basically, like, my point is, like, you've studied for 4 years of medicine in med school. And then once you start your residency, you're going to start practicing medicine. It's going to be very different. So even though like it's things that you've learned already, it's very different when you're actually taking care of patients.
And like you're the one that makes the decision.
Exactly. So, and that's like not really something that you can so much prepare for. And you can always just, you know, the week before, a few days before you start residency, start brushing up on things, which is kind of what I did a little bit. But for the large part, I think you should try to enjoy the end of 4th year as much as you can.
Totally agree.
100%.
Totally agree.
Yep.
Yeah. With the one exception, and I was telling Sheena and you this right before we started. So I did a transitional year. It was at a level 1 trauma. We had to be ATLS certified. So during that orientation week, we had to sit for this test, and it's like a book you had to study, and then you had to sit and do a mock code, ATLS code with a trauma surgeon. And I did prepare for that. So I felt comfortable going in, but some people did not, and they were freaking out. So if you are going to a place that you are as a level 1 trauma and you have to have that certification, definitely read that like the week before you start. You don't need to do it right now.
Yeah. And
Hayden Smith says,
oh yeah.
I was just saying, Hayden says he's looking forward to July 1 to have you down at Baylor.
Looking forward to it as well.
I was just going to say that, you know, you're going to be super nervous, anxious going in, you know, your first day, but you're never alone, right? There's always, you know, you have your upper level, you know, there. So it's okay to ask questions. They expect you to ask questions, even like the nurses, you know, you can ask, you know, how the patient's doing, you know, if you're starting on nights, you know, what happened during the day, you know, all this. So you're never, you know, really alone. You always have someone kind of looking over your shoulders.
Mm-hmm.
Yeah, absolutely.
For the people who are just starting, I mean, make friends with all the nurse and the staff, because they will help you so much during your intern year. I mean, you can either look really stupid or really smart with a nurse that's your friend.
Yeah.
So. That is excellent advice.
Especially in the ICU, when you do your ICU rotations. Yeah.
Oh, definitely. Yeah.
Yep.
I don't even know what ICU rotation is. We didn't have to do that in our transitional year. Okay, we can change it. Like if you were able to change anything about your experience, would you change? I know you said not really. It's been a fairly good experience.
Yeah, everything's been pretty good. I mean, if there's anything that if I could go back and maybe do over,
yeah,
I'd probably ask more questions during my rotations. Like, not that I didn't ask questions, but I really only asked like, you know, the critical urgent questions that I like needed to know. But there's like other things that I would just think to myself, oh, I'll just go look that up myself. But I mean, I think that there were certain things that you could have discussions on with, you know, the attendings or your upper levels, just asking those questions. And I mean, I think you can only use the excuse you're an intern once. And so after a certain point, you know, if you don't know, it's gonna start to kind of look bad. So it's better to just kind of learn, ask as many questions as you can during your intern year, even if it, you know, maybe seems like it's not, or maybe something that isn't as big of a deal, but that's probably the only thing like I would really do differently.
I know, have a question. On your internal medicine months, how many patients did you have to carry?
So our hospital was pretty busy. So I was generally pretty close to capped out.
I bet you $5 eviction and armor.
Sorry.
So like, yeah, I was probably averaging like close to 10 patients a day, if not 10. And then certain times when the hospital census would get a lot lower, it would get better. So like 5 or so. But like I would say for the majority of the rotations, it was pretty high.
Yeah, I agree. That's similar to my intern year. I had 10.
Yeah, I think that's
10 to 12. Yeah.
Yeah.
Yes, very good.
Sorry. So now that you're finishing up your intern year and you're going to start your PGY2 and PM&R, anything that you did, you know, as you're ending your PM or your intern year to prepare you for PM&R residency? I know you said, you know, you're taking the 2 electives, the ortho and the PM&R, but.
Right. Yeah. So definitely trying to review all the notes I took as a med student on PM&R. That's probably a good starting point. But, you know, I'm still kind of having to study for my current rotations and then also planning the move. So it's kind of hard to plan or, you know, prepare ahead. But once things kind of settle down, I do plan to try to get some advice from some of the current residents, Hayden Smith being one of them, seeing what they recommend in terms of preparing for my first rotation at least.
Do you know what your first rotation yet is? Is it medically complex?
It is not complex.
Really? They changed it. So you would have been probably in the team C, and that's what they used to start with, which is just based off your last name. And that you started with medically complex. So it was like a nice rotation because you're so strong on your medicine, and it's a lot of medicine, that rotation.
Patients that have undergone the transplants and, you know, pretty sick patients.
Yeah.
But looks like they changed it. So
yeah. What advice would you give him, Sheena, to get ready for this year?
Don't stress too much. If you know, usually you know what rotation you're starting on. So if it's like spinal cord injury, brain injury, you know, just review kind of the big points there, go over your Asia exam, you know, the modified attribute spasticity scale, just kind of reviewing how to do a good MSK exam.
Right.
But you'll learn a lot during those first 2 weeks of the rotation. So,
and it's nice the way that Baylor does it, because you'll be with the senior for the first week,
right?
And they'll come and help you during your, and Dr. Joey says you are a team A, which is your team, right?
Yeah, that was mine. I can't remember what I started on first.
You blocked it out of your mind?
No. I think it was spinal cord injury, actually. Spinal cord injury.
Oh, that's a good rotation to start on.
Yeah.
I feel like that's the rotation that really kind of brings everything together.
Yep.
The godfather of PM&R has joined us on our Facebook Live, Dr. Omar Salah.
All the support. Love it. You guys have any questions for Dr. Chu here? Anything specific that you want to know about intern year?
Yeah. Well, I can ask him, like, what advice because you were such an exceptional medical student in my eyes, which I'm not easily impressed. No, I'm just kidding. What advice would you give to MS4s getting ready to start their rotations and to get ready for the upcoming season?
Yeah, so that's a really good question. I don't even know if I know the for sure answers, but basically, I think the number one rule would be basically try to be yourself, or at least try not to be someone that you're not. Because basically I think that the people in PM&R are all very, very genuine people. It's a very collaborative environment. And so everybody's always looking for people that they get along well with, they work well with. And at the same time, you don't want to spend, the next 3 or 4 years of your residency, around people that, you don't mesh as well with. So just kind of be yourself, because I think that's just what everybody's looking for, and I think it helps everybody out. And then there's like a lot of other things that I always thought were didn't really need to be said, but things like dress appropriately, show up on time, seem engaged, interested in everything that you're doing. That'll help you a lot on your rotations. And I think for me, the biggest thing for your audition rotations, I think was your presentations. So presentations.
Yeah, you gave excellent presentations.
So like when you're presenting patients to your attendings, or if you have a specific topic that they've told you to look up on and present. Because a lot of times, if you don't have a whole lot of time with the attendings or certain residents, you at least have to, discuss your patients, present them, or, go over your topic. And so that's a good time, good opportunity for you to show like what you're capable of. And so if you can just nail those presentations, I think that'll help a lot.
Yeah, I agree. So I had never, I never rotated with you, or you were never my student. So Benecia, what was so impressive about you as a student when you rotated with you?
He was just always engaged. He really was, and he just went above and beyond. Like when he would do the presentation, it was very, very, not like thorough, but like all the pertinent positives. Because sometimes, you'll get a presentation and they'll tell you things that you don't necessarily need to know. He was just in tune to what was needed at the time for PM&R. And, he just, anything I asked him to do, he dressed appropriately. He was always on time. He always asked what he can do to help and was a huge help. He was just an excellent student to work with and was very pleasant, engaging.
Nice.
That was great. Mm-hmm.
Thanks so much, Dr. Williams. I appreciate it.
No, you're welcome. You'll do great. You'll be an excellent physiatrist, and I look forward to what you have to bring to the field, because I know it's going to be good things.
Thanks so much.
Yeah, you're welcome. Dr. Slot kind of asked some questions, but we went over we had those questions answered already. Omar, we asked him, what did you do to prepare for intern? He asked, how scary was your first call? And we were like, it was terrifying.
Absolutely.
As was mine. Yeah. Elijah says, what resources did you use to prepare on your rotations?
Well, that's a good question.
So I don't know if he's talking about maybe like the internal medicine rotations is my guess.
Yeah, you can do both if you want. Yeah.
Yeah. So I think obviously UpToDate is going to be your best friend. Have that, accessible to you at all times. I have the app on my phone, so I could always pull things as I'm walking to patient rooms if I need to look something up. UpToDate's definitely a really good resource. If you guys have the pocket medicine, that's also something really good and useful to carry with you. Our program gave us kind of like a call book. So a lot of topics that, you'll get called on, they'll kind of go over what to look for, what to order, how to kind of manage those acute issues. And so that was a pretty good book to reference on occasion as well. And then our program also had some other kind of cheat sheets, like antibiotics for certain infections, what are your first lines, second lines, and then see what other resources some of the upper level residents have as well as like some of those cheat sheets. And so I think those are kind of all the things that I used for my medicine rotations that helped me a lot.
I have a question for what do you think their top 3 things you treated the most? Because there's kind of bread and butter things that you will admit patients for and let them know what they are, and they can kind of start thinking about those.
Definitely. So for me, it was by far COPD exacerbation. I had so many of those. Like I'd get multiple admissions for those every day. Like it was insane. So COPD was a big one. Chest pain, that was a big one. And cellulitis. Those are probably the main ones. But then there's also like CHF exacerbations. Those are very common. Stroke rule outs. Those are very common as well. I think those 5 would probably be the most common ones that I would see.
Yeah, I would say like bread and butter that you'll know, but like now you know it like at the back of your hand, right?
Yeah, exactly.
Dr. Salad says you wore MABS blue.
We're all wearing some color of blue today.
Yeah. I'm wearing sailor colors. How much does internship make you appreciate the world of physical medicine or rehabilitation looking ahead?
It helps me appreciate it a lot. I mean, so because a lot of your patients are going to be coming from the acute hospital when you're working on the inpatient rehab unit. And so it's good to know kind of what happens to the patients before they get to rehab. And then it gives you a better idea of what to look for moving on. And so it's helped a lot. I mean, and that's another one of the reasons why I would recommend doing internal medicine prelim as opposed to something else, just because so many of your patients are coming from, you know, the floors of the hospital.
Totally agree. And I'll kind of discuss this before we started as well. And, you know, it's only 1 year and you will have some tougher rotations, and you just have to remind yourself, like, there is an end date to this. I can get through this. Try to have a positive attitude, and just soak it up and just know that you'll never have to do it again. And then you're like, when you get to rehab, you're like, oh, thank God I'm going to be okay. For the most part, yeah. Yes, there is an end.
All right, great questions.
Anyone else have any? Yeah, there have been some really good. Anyone else have any questions out there for Dr. Chu? Please feel free to ask as we roll through.
That's a good question, Dr. Slott. Yeah. So Dr. Slott asked, did you understand? So, you know, patients, they come to the hospital and they get treated. And then there's always a question of disposition, you know, where are they going to go? They're going to go home, you know, do they have to go to skilled nursing or, you know, acute inpatient rehab? So did you feel like you understood that process a little bit more than maybe some of your other internal medicine colleagues, you know, the other interns, just because of the background of you maybe doing a PM&R rotation beforehand?
I would say so. I mean, a lot of us being PM&R residents, I think, or prelims, I think a lot of us had a better idea anyways. But just kind of like knowing, you know, for inpatient rehab, can these patients do 3 hours of rehab? And knowing that that's kind of a requirement for the patient to qualify versus some of what the other facilities are, like an LTAC or a SNF. I think, you know, the experiences that I had in PM&R, I wouldn't have known that what the differences were if I hadn't done some of the rotations. So I think it definitely helped just kind of understanding what dispositions some of these patients would do best in after the hospital.
Totally agree. Because I think when you go to a place that is internal medicine heavy, they're so focused on getting this patient, you know, from being critical to non-critical. And then I even as a consultant now, I'll read it and they're like, oh yeah, dispo tomorrow, patient's going home tomorrow. And then I'm like, they call me in when they're ready to go somewhere. And they're like, oh, it's been 2 weeks. This patient hasn't gotten out of bed. I'm like, this patient's not going home. So
I agree. Same thing in my internal, you know, medicine, my prelim year. I was the only PM&R, you know, prelim. And so I was able to kind of help with disposition because, like exactly what Benecia said, you know, you have to discharge your patient by 10 a.m., get all your stuff done. And oftentimes they weren't sure exactly, you know, where to send this patient, and social work would get involved. And so it's good if you're able to kind of prep the patient, obviously, a few days before they actually leave about where they're going. So
Right.
As a rehab intern, did you find yourself paying more attention to the therapy notes compared to maybe some of the other colleagues? And did that change your care of approach?
Yeah, I mean, I was probably one of like the few, I guess, specialties that would actually read the therapy notes. I don't know how much the other residents, I mean, I'm sure the other PM&R residents were reading them, but
yeah, and it's like a different language too.
It is. Just understanding the lingo, like it, yeah. So yeah, I would read them and try to kind of formulate what I would think would be a good dispo plan for them. And you know, sometimes that's what would end up happening for the patient. You know, sometimes it's not. But it was good practice just reading those notes, and then also just not getting too rusty with reading them. And so yeah, so it was definitely helpful reading.
Okay, Sierra asks, what was your thought process for which programs to apply to? Do you think with interviews becoming becoming more virtual, would you apply to more or less programs, same number, you know, given because things are just changing so much for this upcoming class?
Yeah, so that's a good and interesting question. I mean, I think this is all kind of uncharted territory with with these virtual interviews. I mean, I've heard different camps. I mean, I've heard, well, since it's virtual, you don't have to pay for the flight and everything. It's a lot cheaper. You should just apply and do as many interviews as you can now. But then I've also heard that it's kind of putting some of your other students at a disservice, because then you're taking up spots for them. And if you're not really interested in the program, then, I mean, I don't think you should really just do some interviews just to do them. Like, I think you should do the interviews if you have a genuine interest in going to the program. And so for me, like when I was deciding which programs to go to, I think the location had a really big factor for me. And so I wanted something nearby. And so Dallas fit that bill for me. But I also did my audition rotation at Baylor, and I mean, I absolutely loved it there. And so I, like, even if it wasn't the best location for me, like I might still have chosen Baylor as my top program, just because I really loved working there, the people I met there, and I thought it was gonna be really good for my education. And so, but yeah, going forward, it's really hard to say how many interviews should you do now,
right,
if they are gonna be all virtual. I mean, I think you just gotta look at your application. I mean, everybody's gonna have a different magic number on how many interviews they have to do. And so I think if you talk with your counselor, see kind of where you fit, they can give you some advice on how many interviews you should do.
Yeah, and I feel like, I feel like that they might end up capping it. I saw on Med Twitter that I think emergency medicine is capping the amount of interviews that you're able to have. So I feel like that might happen for a lot of residencies.
Yeah, I think that's a good idea. And Sarah, the charting for outcomes is a really good resource if you don't know about it, where you go on the NRMP website. And I think the most updated version is 2018, where you can see, you know, all the different specialties, what your average, you know, the step scores are, how many interviews those people went on. And so you can kind of see where you fall on that chart, and you can kind of gauge how many interviews you should go, you know, based on that. But obviously, you know, everything's not black and white. There's no 100% correct answer, but that will at least give you a general idea of how many to apply to.
Mm-hmm.
All right, last question from the audience. Dr. Salat is coming up with good ones here. In the years past, he's noticed interns were frowned upon for going into PM&R. The pleasure, plenty of money, and relaxation comments, which are not accurate, as we know. Has that culture changed in terms of perception for rehab interns?
I mean, I'm not gonna lie that I have heard the plenty of money and relaxation a couple of times during my intern year. So I think that sentiment is kind of still out there. But I think
who's saying that? Are it those other PM&R residents, or is it like the internal medicine?
Non-PM&R, yeah.
Yeah.
And so I think it's just going to be important for us as physiatrists to kind of, you know, promote for ourselves and kind of tackle that stigma as much as we can. Because as you were saying, we all know it's not really true. And so, and PM&R is becoming a very competitive field. And we do work very hard. And so I think it's still kind of there, but maybe getting better some.
And I think that's, you know, I don't know if you guys have seen all those burnout surveys, you know, who knows how accurate they are based on sample size, but unfortunately physical medicine and rehab is a little bit higher on that burnout, you know, scale, just because maybe it was people came into the field thinking it was all about, you know, plenty of money and relaxation, and that's not the case.
Yeah.
So.
Yeah, you're taking on patients that I tell them when I see them in the hospital, like I typically meet them on the worst day of their life. Mm-hmm. And that's a lot to take on. So it does take a special personality to really be able to be a positive person for patients when they are going through some of the most difficult times in their life, with a spinal cord injury, traumatic brain injury, having a devastating stroke. So you do have to for sure remember that when you pick this field. There is one more question that actually came in. It says, if you talk noise to your attending and you lose a dinner bet, should you have to pay as an intern, or is that considered intern abuse? Someone's asking for a friend. I bet you can figure out this.
Anonymous question.
That's intern abuse.
I think the conditions of the deal need to be reevaluated. If that intern actually loses, then it's appropriate to pay for the dinner. But until those conditions have been met, I do not think that intern has to pay for any dinner.
Did you guys bet on the Mavericks versus the Rockets this season? Is that what this is about?
So we bet, me and Dr. Salad and a couple other residents, that the Rockets would finish in the top 4 of the Western Conference by the time the season ended. That season has not ended, so it is not possible for me to have lost any bet.
Yeah, it is true. It is true.
That's funny.
Sheena, do you want to do our last?
Yeah, we'll do our last question.
Yeah, this has been great.
On that note, Yee, so we always ask all our guests. We forgot yesterday, but
we'll ask them on social media.
Yeah, Tristan's social media that he does not have. So if you were not a PM&R physician, what would you be?
So I would probably be, if anybody was looking for a shorter, slower Jeremy Lin, I'd probably be a basketball player. And I don't think anybody's looking for that.
I love it. That is amazing. Well, hey, we really appreciate you coming on our show and spreading some light on intern year. We look forward to having you. Yeah, we should have you on sometime during your PGY to kind of do a check-in to see how that is going and any advice we can offer, but you'll be great. You'll love it.
Awesome.
You're going to go to a great program. So very good.
Well, thank you guys so much. I mean, I really appreciate you guys having me. I think you guys are doing some really great stuff here. So thank you guys.
Thank you.
Have a good one.
Thank you. Sheena, do you want to give a little preview for what we have next week?
Yeah, so next week we have another doubleheader. I guess we don't have anything to do over the weekends.
So. Right, we clearly you don't have a life. So I'm just kidding.
No. So on Saturday, we're going to have, Dr. Rachel Welbell, who we both are very close with, and we're good friends with her. She is a sports medicine physician in Chicago. And she is actually on the front lines right now in Chicago, running basically on her own inpatient rehab unit with COVID patients. So
it's all COVID patients.
It's really interesting to kind of see her take and what she's doing. And then on Sunday is Dr. Julia Frete. She's a sports medicine physician at Columbia New York Presbyterian. Specializing in dance medicine. She's also one of the U.S. team physicians for the skiing and snowboarding team. And she volunteers, so she's in New York City, she volunteered to be on the front lines treating patients with COVID. And her story is actually really interesting. She was on CNN and spoke with Dr. Oz and a few other newscasters, because while she was working, her application for a green card initially got denied. So we'll kind of hear about her story, and should be good.
Yeah, very good. Awesome. Hey, you guys have a wonderful Sunday, and we appreciate you guys tuning in as always. So you can find this episode on our Instagram TV probably in the next hour or so at the.virtual.physiatry.mentors. And then we will also have a link of our YouTube page where you can find this episode, as well as our podcast is available on Spotify. We will put that link on our Facebook and Instagram, and it should be up on iTunes here. Shout out again to Dr. Hayden Smith, who's helped us with that. Yep. So hey, you guys have a good one. Thank you.
See you next week.
Bye-bye.
Bye.